How to understand your audiogram results for better hearing. Understanding your audiogram results is essential for improving your hearing health. An audiogram is a visual representation of your hearing ability across various sound frequencies and intensities. This information is obtained through pure tone audiometry, which is the standard test for assessing hearing. By interpreting your audiogram, you and your healthcare provider can identify the type and degree of any hearing loss you may have, guiding you toward appropriate interventions. First, let's look at the axes of the audiogram. The horizontal axis, or x-axis, represents the frequency or pitch of sounds, measured in hertz. Frequencies range from low sounds on the left, around 1 to 5 hertz, to high sounds on the right, usually up to 8,000 hertz. Most speech sounds fall between 250 hertz and 6,000 hertz, with vowels at lower frequencies and consonants at higher frequencies. The vertical axis, or y-axis, represents sound intensity or loudness, measured in decibels hearing level. This scale is inverted compared to typical graphs. Softer sounds are at the top, while louder sounds are at the bottom. The lower a mark is on this axis, the louder the sound needs to be for you to hear it, indicating worse hearing at that frequency. Each point plotted on your audiogram shows the softest sound you can hear at a specific frequency. Normal hearing thresholds range from decibels to 25 decibels across frequencies. If your thresholds are above 25 decibels, it indicates some degree of hearing loss. Hearing loss can be categorized into degrees. Mild hearing loss ranges from 26 to 40 decibels, where you may struggle to hear soft sounds or conversations in noisy environments. Moderate hearing loss from 41 to 55 decibels makes conversations harder to hear, even in quiet settings. Moderately severe hearing loss from 56 to 70 decibels leads to significant difficulty hearing speech. Severe hearing loss from 71 to 90 decibels means you may only hear loud speech or sounds very close to you. Profound hearing loss is above 90 decibels, resulting in very limited or no hearing. Patterns of hearing loss can also be observed on the audiogram. A flat loss indicates similar hearing loss across all frequencies. A sloping loss shows better hearing at low frequencies and worse at high frequencies, which is common in age-related hearing loss. A rising loss means better hearing at high frequencies than low frequencies, while a notched loss shows a dip in sensitivity at a specific frequency, often related to noise exposure. Interpreting your audiogram helps you understand your hearing health better. A steady line near the top indicates normal hearing, while a line that drops lower at certain frequencies shows hearing loss at those pitches. Knowing which frequencies are affected allows audiologists to recommend suitable treatments, like hearing aids tailored to amplify specific sounds or other interventions such as cochlear implants or surgery. Audiograms are often accompanied by additional tests, such as speech recognition tests, tympanometry, and acoustic reflex testing, to provide a comprehensive assessment of your hearing. By learning to read your audiogram, you gain valuable insight into your hearing health. This knowledge enables you to have informed discussions with your audiologist or healthcare provider about managing hearing loss effectively. Always seek professional interpretation and personalized advice for your diagnosis and treatment options.